Hello, my name is Major Jeff Gainock, and I'm a certified registered nurse anesthetist at William Beaumont Army Medical Center. For those of us who provide anesthesia to children, we know the anxiety that parents can have when their child comes in for surgery. It can be scary to turn the care of one's child over to a group of people who are largely strangers and not allowed to remain nearby. The purpose of this video is to provide an educational tool for parents to gain a better understanding of the anesthesia care their children will be receiving during their stay with us. It is my hope that by the end of this video, you will have greater knowledge of the anesthesia process, and this understanding should decrease any fears or concerns that you may have. On the day of your child's procedure, you may be asked to arrive early. This time is used to have your child registered and checked in to the appropriate systems by professional staff that will be handling the care of your child. This also gives you a chance to meet the team and ask them questions. Your child will have an opportunity to meet them and entrust them, making the process less stressful for them. The check-in process allows the team to get the most up-to-date information. We want all children to be their best state of health before their procedure begins so they can heal up well. The anesthesia provider is primarily responsible for the health of your child during the procedure. They will ask questions about the child's medical history, including illnesses or symptoms. This will help them care for your child during the procedure. They will be interested in child's medication allergies to food or medicines and last time your child ate. No eating or drinking is very important before your anesthesia. Vomiting while someone is conscious or semi-conscious can be very dangerous. The anesthesia provider will perform a brief examination paying attention to temperature and any activity which helps your child feel safe and cared for. This allows your child to feel comfortable with the healthcare provider. We want anesthesia care to be as smooth as possible. The anesthesia provider will go over the anesthesia plan and answer any questions you or your child may have. Since most children fear shots, they will be under anesthesia prior to their IV start. This is accomplished by having them breathe inhalation anesthetic when they arrive in the operating room. The anesthesia provider will go over the risks and side effects of the anesthesia, focusing on all the side effects including nausea and vomiting or possibly sore throat. Knowing what will happen will relieve stress and tension for parents. Explaining this to children in an age-appropriate fashion will allow them to be less stressed. Children are allowed to bring a favorite toy with them to the operating room to help keep them calm. The surgeon will introduce themselves to the parents and answer any questions or concerns. They will also confirm with you what the procedure is and what part of the body it will be on. They will use a marker to mark where the procedure will be performed. To relieve the stress of the child, a mild sedative may be given to them before the procedure. The fluid is mixed with syrup to give to the child. It may make them drowsy. Once the child is moved to the room, the team will once again check the child's ID and confirm what surgery is and what part of the body will be involved. This is called the timeout. It is a safety measure to ensure that everything is done correctly. A breathing tube may be put into the child's mouth, but it will be removed prior to the child's awakening. During the surgery, the anesthesia provider will constantly be with your child and monitor everything while they are asleep. The anesthesia provider is critical to surgery. Because of the highly technical machines and procedures, the anesthesia provider ensures the child stays asleep during the entire surgery. They check the child's position and condition constantly, ensuring the exact amount of anesthesia is given. At the end of surgery, the anesthesia provider reduces the anesthesia until it is off. When the child is able to make purposeful movements, the breathing tube is removed and the child rarely remembers waking up from surgery. The child is then moved to the recovery room called the post-anesthesia care unit. A full report is given to the PACU nurse. The child's medical history and medical problems and medications are also discussed. Pain medicine may be given to the child to reduce pain, and parents can come in with their child. It makes the child and the nurse feel better. The parents can take their child home once they are feeling better. I hope you gained a better understanding of the anesthesia process for you and your child, as well as decreasing some of your anxiety. We at William Beaumont Army Medical Center want to ensure that you have a clear understanding of the anesthesia process and feel comfortable allowing us to care for your child. Our #1 priority is your child's safety, and we want them to feel special and well cared for. Thank you.